medication video is a medication video to show you how to mix and administer hCG, human chorionic gonadotropin, which can also be the trade names of Pregnyl, Novarel, or even a generic variety of hCG. So first off is, what is hCG? hCG is what we call trigger medication when we're dealing with IVF cycles, but you also can even be using this for an intrauterine insemination cycle as well. And just a quick one line of what that medication is for is it's to induce an ovulation. The goal is, prior to this medication, you may have been on something that has helped to stimulate multiple egg growth. And what this medication is going to do is finish up the final maturation step for those follicles and mature eggs that you've developed, and help them to prepare for an IVF retrieval or for an intrauterine insemination. So think ovulation, think mid-cycle. Every month in a natural cycle, you have a surge that is an ovulatory surge. When we're doing cycles that are for fertility, we're timing a lot of times that surge to happen when we have been monitoring your response to your medications. We're looking to find the right time, the best time for you. So you're a nurse, this is a big injection, especially when you're doing IVF, which is why we often call it, a lot of people know it as trigger shot. A lot of people know it as an intramuscular shot, so that already answers where does it go. It is a muscle injection that is going to go in the gluteus muscle. And very much so, oftentimes you will meet with your clinic nurse, potentially in person. I know we try to do that with our patients because it's a big important shot, and we want to make sure that we draw some circles on your buttock area and review and give you printed review instructions and review this medication again. So this video will be hopefully archived, of course, at Mandell's PharmAssist, and so feel free to know that it's there to you again, to watch again and again. However many times you need to see this, take a peek and take a look. With it being an intramuscular shot, that is something that we recommend oftentimes to have somebody administer the injection. And so if you have a significant other, a mother, a partner, whoever may be at home with you that can administer this injection, a lot of times it is going to be that person that would really be good for them to watch this video with you. Even if you do the mixing, but they do the administration. You make it a team effort, and I think that that's fantastic. So definitely, watching this together would be wonderful once we have all of this archived for you. So it's a muscle shot. It's considered the trigger ovulation injection. A lot of people feel a lot of pressure, but we want to do everything we can to help ease your mind with this medication in terms of instructions. And so believe me, a lot of the clinics are on this very much so when they're giving you your instructions. They know that it's a big day. It's big for before an egg retrieval. First thing I always mention is supplies that are needed. So I have my little supply list. Once again, hCG is the acronym for human chorionic gonadotropin, which is a very big mouthful. And we've got a lot of acronyms in fertility. So I feel badly that we try to do our best to try to make it, simplify it, because it's not easy. But trade names can be Novarel or Pregnyl, or even a generic variety. What you would need that your box, and I just happen to have a box here of the Pregnyl to see, is that in your box of your hCG, there will be one vial that will contain powder, and you might see that this has a little bit of white powder because this is for demonstration. So it can be a powder form, it could be a tablet, it could be a wafer, it could be broken up and be granules. The powder is the powder, no matter what way that looks in that vial, okay? Because sometimes different vials shift and look differently, etc. So we don't want you to worry that it's not a full form tablet. It's a powdered vial. It's got the powder in there. The other vial that you'll have is sterile bacteriostatic water, and this is what we'll be using to mix with that vial to make sure that we get all that powder and all that hCG that we need for ovulation. So you'll have one vial that'll have sterile water. The other thing that you will need is a 3 cc, and remember, I'll mention here, cubic centimeter is equivalent to a milliliter, meaning that nurses have different lingo, and I found that sometimes a patient would say, well, the nurse told me to do 1 cc, but you're saying 1 ml. We just often have different lingo, but it does mean the same thing. So mathematically, if I were to write 1 ml equals 1 cc, it's the same. It's just a different way of saying the same thing. So sorry for any confusion that we give you sometimes, but it's always fine to ask us and clarify. So 1 ml equals 1 cc. So what you're looking for is a syringe that might be in a package similar to this, but definitely when you look inside, it's that bigger syringe and it'll say 3 milliliter on it. And it may have a needle attached to it. And if it does, what you may see that it says here on the label is that that's a 22 gauge, 1.5 inch needle, and that's your injection needle. If it doesn't have a needle on it, because sometimes the pharmacy might just send you a package, and I'll just put my hand over like this. They might send you a package that just has a syringe, but then they'll send you separately a little pack that will look similar to this, which would have an injection needle in it. So that's what I want you to know is it's okay. It's the same thing. It doesn't have to be attached, but it could come separately. Our pharmacies work great on getting everything that you need. And sometimes it could just look a little different from prescription to prescription. So it's still the same thing, even if it's separate, okay? So your box, which then you have your 2 vials and your needle and syringe. You will need actually 2 of these if you have them, because you are gonna mix the medication with 1 needle, and then you're going to borrow the needle from the other syringe to apply to the mixture syringe to give the injection. So what I always say to patients is you need 2 22 gauge 1.5 inch needles. Not doing 2 shots, you're mixing with 1 needle, but it's the exact same needle that you then need to administer the injection into the glute with, okay? So it's still 1 injection. And this, by the way, is a one-time shot. You don't repeatedly ovulate in your menstrual cycle. So because this is the ovulatory drug, you will only need to administer this injection once, and then you'll prepare for a procedure of maybe a retrieval or an intrauterine insemination. So something that the nurse in me always has done is it's not a sterile technique to mix your medications, but it is a clean technique. So what you want to do is wash your hands once you gather all of your supplies, or you could even do a little hand sanitizer, which is what I happen to have here just for the demonstration. But what I really just want you to see is just it's a good idea to have nice, clean hands to start when you are mixing and administering your medication. But I don't want you to think it's a sterile technique requiring gloves. It's not. It's not a sterile technique in that regard. The needle will be sterile that'll be going into the body. That's the part that's sterile, okay? So what we have here is we have our 2 vials, and they each have a plastic cap. When you hear me flick that cap off, or you might not hear it because it's kind of silent or actually a little quiet. Underneath those caps, when I first open them, technically it is sterile. However, once again, the nurse in me is anytime I'm putting a needle into something, I always want to clean that surface. So I take a little little alcohol prep pad that I got from the pharmacy. Or what I also want to just mention is that if you don't have those prep pads, don't feel like you have to go out to the pharmacy and get them. Just grab yourself your isopropyl alcohol and grab yourself cotton balls, and you can wipe the tops with that. So sometimes I have had patients get a little nervous if they don't have alcohol prep pads. And I always say to them, get some alcohol, and just a little rubbing alcohol and cotton balls will work just fine, okay? Once we clean the tops of those vials, our next step is going to be to open up the package with the needle and syringe. So we open it up. One little hint that I mention, and you may forget to do this, but I just mention it, is sometimes just give a little extra click to that syringe being on that needle. Sometimes it could be it's a little loose, and I just don't want that to happen, anything to happen during your mixing. So if you just take it and kind of give a little push, if it feels tight, then it's probably good. But once in a while, I've opened one and it has been a little loose, so I just twist it on a little bit tighter. Don't over tighten, because you do have to remove that mixing needle after you've done your mixing before you put on your injection needle. Our next step here is that we are going to first draw up 1 ml, 1 cc. So the reason I'm doing that, guys, is that your nurses are going to guide you with how much liquid, but typically when we're mixing a medication for a muscle, Oftentimes we use 1 ml. Can we use a little bit more? We can, but it's not off. You don't need a lot of fluid. You need enough to mix the medication. And typically a muscle injection is 1 milliliter or so, give or take. So what I want you to know is the amount of liquid that I'm drawing from the vial, I'm going to inject and draw up some air, 1 ml. And the reason I'm doing that is there is a bit of pressure in these vials, so it just helps to regulate a little bit of that pressure that you might get from drawing up the medication. If I forget this little step of putting a little air into the vial, is it a make or break? It is not. So I wouldn't want you to worry. If you just put your syringe in here and draw up, that's okay too. Completely okay. So what we're going to do is we are going to insert the needle directly into the center. We're going to turn it upside down. I'm going to let you see that there's some bubbles that happen there when I push the liquid in. Push the air in, pardon me. Creates bubbles. And then when I let go, there's a little bit of pressure because it's equalizing that pressure a little bit. So it's pushing down right now on the plunger. It'll stop in a second. So what I do is I just take what I need and I line up to that number 1. So I've lined up to the number 1 because that's all I need is 1 ml, 1 cc. Once I do that and I remove the needle from this vial and I have lots and lots of extra water, don't save this. It can go into regular trash. I know it might seem wasteful, but hCG is utilized for other medical issues, and sometimes people are taking divided dosages or multiple dosaging or things like that. So that's a reason they do provide a little bit more water than you need for fertility. But for fertility's sake, it's a 1 ml out, and this usually has 10 mLs in it, 10 milliliters. So what you do is you discard it after you're done. After you've taken out your 1, you just get rid of it. Next step is to take your vial that contains a powder, insert the needle, and push that liquid in there. It's going to dissolve that powder pretty quickly. I always say to patients, just keep your hand, if you can, right on that syringe, and then just roll. Roll and let it sort of mix. It's a little bit cloudy at first, but you really want to get it so that it becomes clear. So you're mixing everything that you need. So pretty much I'll see that it's clear at a certain point in the process, and I won't have had to move my needle yet at all. And then what I'll do is I'll turn it upside down. Here's the little trick. This needle is all the way up to the top of the vial here. So in your vials that you get from the hCG that you'll be given as your prescription, in this vial, there will be a little window down here where the rim of the silver rim is, for you to draw that needle, pull it way down, almost have it hanging out of that vial, okay? So have it hanging out of that vial, as much of it as you can without having the whole needle come out. So I keep that little tip in there, and now what I do is I pull down here on the plunger without moving the needle. I pull down on the plunger, and I'll be able to drain that 1 ml. And then you want to get every little drop that you can. And if you have a little droplet that's left in your vial, but you have the 1 ml here or a little bit under the 1 ml, that's okay. But if you're at a half of a milliliter, because there is a half milliliter marking, and there's a half in here, there's a lot left over, go back in to get it out. You want to get as close to that 1 as possible, but there might be a little droplet that you cannot get out of this vial, and I really just don't want you to panic over that, okay? It's okay. It happens even to me, even to your nurses, even to the medical community that are working with these vials as well. Now, once I have it like this, I'm simply going to cap that needle to discard it, because that was my mixing needle, and that's not the one that I'm going to have as a sterile needle to give the injection. So I discard that in my sharps container. In the case of what I have here, I said to you, sometimes your needles could come separately. My needle isn't coming separately, it's attached to another syringe. So all I need to do is twist this one off, get rid of this extra syringe, and twist the new needle on. And then what I do is, if I do have some bubbles with this one, which I do have like a couple little bubbles here, I'm going to snap. It's okay. If I forget to snap, that's fine too. And then I have a little pocket of air. You might be able to see it where I have the fluid and then a little bit of air. What I want you to do with that, with the needle capped, is just slowly, slowly, slowly move the fluid to where you see it go right through where the needle's attached, and then leave it be. Do not do a lot of squirting. I've taught many classes with patients in person, and it gets kind of fun because we're mixing, and then people start squirting the medication. Keep in mind, this is valuable to you, this medication. This is a big shot, and it's just valuable to you to not lose any of it if you can. If a little squirt goes out, it's okay, but you don't want to keep squirting medication out of it just to get, you know, that bubble out, okay? So the idea is just to know that it's 1 ml of the water that we draw up from the original vial of water, and then that entire 1 ml goes into the powder. It mixes that powder and dissolves, and we want to draw up as close to that 1 ml as we can. And then this injection is now ready for administration. With the hCG, this is a muscular shot, and usually this is the first muscular shot that any of the couples might be taking. So a couple tips to help make it not seem so daunting. You might be at a clinic that would recommend that you could use a little bit of ice to the buttock, but you don't want to over ice. So a little bit of ice means maybe 2 to 3 minutes at most. Set a little timer on your phone, and you can apply a little ice pack or an ice cube. But usually these areas will be marked for you by your nurses potentially at your clinic. Or you might also have an opportunity where you might be able to have something like the Sonera patches, which is a numbing type of cream that might be beneficial to you, because some people do, you know, get so nervous about an injection that they might want something else that they can utilize. The reason why we sort of mention icing is just because everybody has that available to them, and we don't want anybody to feel like that they can't utilize those Sonera patches, okay? So just without further ado, I'm going to get the mannequin that I have here and show you that where we administer these injections are typically going to be marked for you, and it's going to be in your glute area. And what you'll see here is this is the fatty tissue, this is the muscle, and here's the sciatic nerve. So what we're trying to do here is we want to administer this in the area that the nurses will have marked. And so you can feel free to know that usually we are very good at marking for you, so that sciatic nerve is typically not a worry for you with regards to giving the medication. With the trigger shot, it is a one-time injection. You take it only once prior to the retrieval or insemination. So you will have us, we will mark both sides, but you will only need to use one side. It's just whatever your choice is. You can stand up for this injection. And if you do, if I were standing and I was receiving this injection and somebody was behind me in my right glute, I'm going to put all my weight on my left side, and then I can lean a little bit and just put light pressure, put my leg down lightly so someone can give the injection in that right glute. If, however, you would rather lay down, this could be somebody that I'm giving a shot to tonight, just say, and she might be laying on her side. She's relaxing her muscle, and I'm going to give that injection into her relaxed muscle. Just for sake of being able to show you what this injection looks like, I'm going to stand the mannequin up for us to see that we will have the area marked, so we could put either a patch 20 to 30 minutes before this trigger shot, which I will say your clinic will tell you the time of this injection, but in terms of a fertility cycle for IVF, this is typically a timed injection that you will have a very specific time that you take your injection in the evening, but your clinic and your nurse will be the ones that will give you that information. So what you want to know is you're going to give that shot in this area, so you could either use the Sonera patch, apply it 20 to 30 minutes beforehand, it'll feel a little warm here, or you could utilize that ice for 2 to 3 minutes. But that would happen first. Then our next step is to wipe the area with a little bit of alcohol. With this shot, because it's muscular, we do not pinch to give it. We simply can place our hand in this area and have even our palm open a little bit, so that the area that we're giving the injection, we don't want to squeeze because we want this needle to go just directly into the muscle. We can hold the angle in our hand of this needle at a 45 degree. And we say a little dart-like motion just to give you the feel for this is what it looks like, but you don't have to use a harsh injection technique. Just a nice gentle, when it makes contact with the skin, let the needle follow through. Once the needle goes in all the way, you hold the needle in place. You pull back a little bit on the plunger, just to see if any blood enters. It's very rare, guys, to have blood enter. At our clinic, typically what we would have you do, if a little blood entered, we would advise you to remove the entire needle, change that needle, but use the same syringe with the medication already in it, and go to the other side to attempt re-injecting to the muscle on this side. That's our little technique. Some centers might let you just pull the needle out a little bit, check again, and if you don't see blood, you could inject. So follow whatever your center gives you as instructions with this, but it doesn't happen often at all. So really when you pull back and you see no blood, you will simply push all the medication in, and then you will do a 1, 2, 3, remove the needle gently, place it down, put a little pressure there. There'll be maybe a little bit of blood or a little bit of water-looking fluid that'll come out because it's the medication, so you want to give pressure there. You can apply a Band-Aid, but don't leave Band-Aids on for a very long time, even if you don't have allergies to latex, etc. They can just leave a little bit of a rash, so we don't want you to have that rash. Okay. The next day, what you might notice is if you rub this area, it might feel a little bit like a bruise. That's normal. You might even have a little tiny bruise there. That's normal. If you have any other skin reaction, redness, itching, swelling, pain, severe pain, etc., by all means contact your clinic to have them advise you of any of your next steps. All right. And so the trigger shot is a very big one, and for many reasons, because it's the first muscle shot that you take, and it's that big trigger before the procedures of insemination and IVF retrievals. But we don't want you to worry. Your centers and the use of this video will hopefully help to alleviate any worries that you're doing something wrong. But between your guidance, between your nurse team and your physician, we know, and so many people have been able to conquer getting that shot done, and so we have confidence that you guys will be able to handle that as well. Best of luck with your HCG and best of luck with your cycle.